Hello again, this is Dr. Rob Lindsay with our Diabetes Treatment Success. Secret number 15, the adrenal glands. Now, your adrenal glands, we talked a little bit about this, but they make a hormone called cortisol. Now, these little glands sit on top of your kidneys. They are your stress glands. They make a lot of different hormones for your body, in addition to cortisol, such as aldosterone and your androgen hormones. Your adrenal glands are vital for optimal health. When your adrenal glands are not working, it causes high levels of cortisol in your system. And this is why you still have symptoms, even when other lab tests may be normal. Cortisol is one of the main factors that regulate your blood sugar level, not insulin. Everybody thinks it's insulin, but it's actually cortisol. When cortisol is released by your adrenal glands, it's accompanied by cytokines. Cytokines suppress the ability of your pituitary gland and your hypothalamus to make thyroid-stimulating hormone. So your adrenal glands make cortisol in response to a stress, whether it's physical, chemical, or emotional. And cortisol also promotes inflammation, which makes your adrenal glands pump out more cortisol. Now, as cortisol is released, the cytokines come out along with it, and they suppress your pituitary. Now, there are common causes of elevated cortisol, some of them being chronic stress, post-traumatic stress disorder, or hidden gut infections such as parasites. You'd be surprised how many people have parasitic infections. Other causes of elevated levels of cortisol include blood sugar dysregulation, high or low blood sugar, hypoglycemia, insulin resistance, and diabetes. You need to make sure that your blood sugar level is stable, and you need to understand that when you have these problems, when your blood sugar level is going up or down, so are your cortisol levels, which means your cytokines are going up and down, which means your pituitary isn't working properly, and you're not going to make enough thyroid-stimulating hormone. So you start having thyroid symptoms after you have diabetes. All right, you start having fatigue and hair loss, cold hands and feet, insomnia, inability to lose weight, depression. And don't forget, there are several types of blood sugar problems, not just diabetes, but also hypoglycemia, low blood sugar, and insulin resistance. Hypoglycemia is a blood sugar level of 85 or lower. Insulin resistance is a fasting blood sugar of 100 to 126. And diabetes is a fasting blood sugar level of 127 or higher. So be aware, if your stress levels are going high, your adrenal glands are going to pump hard and cortisol levels are going to increase. Cytokine levels are going to increase, and it will cause your pituitary not to function properly, which will cause decreased amounts of thyroid-stimulating hormone. High cortisol will sabotage your attempt to combat your thyroid problem. If you're suffering from adrenal fatigue, you need to avoid refined sugar, alcohol, and caffeine because these are high stressors to your immune system. And don't think you can get away with eating aspartame or MSG because these are the worst things you could do for your adrenal glands. Don't suffer another minute. 952-949-0676. Call and schedule a consultation. I look forward to seeing you on our next Diabetes Success Secret.